Hi, my name is Chris Costa from Platinum Plastic Surgery in Las Vegas, Nevada. Today, we're going to be answering your questions about plastic surgery. How early can you get a breast augmentation? I recommend being at least 18 years old to make that sort of informed decision for yourself. It also allows you to finish development from a puberty standpoint. By the time you reach 18, we don't expect a lot of changes to the breast related to puberty. So that's a good time to come in for a consult to see what size would be good to get you to where your goals are. This is one of the most common questions I get all the time. Do I need a lift? Or someone comes in, they want breast rejuvenation. They just heard of a breast implant before. A lot of times we have to kind of educate people about what the indications are for a breast augmentation alone versus a lift or combining the two procedures. For all of our patients, we're going to meet with you and find kind of what the best procedure is to get you to the goal that you're looking for. If you think of these two procedures as being completely different procedures, that helps. A breast augmentation is using an implant to augment and change the size of the breast. Augmentation alone is a procedure that is done to increase the size of the breast. It is not done to lift the breast, to tighten the breast. It is really done to add volume. That is the goal. So my patients who either want to go up a cup size or two, or they're looking for more upper pull fullness in their chest or projection, breast augmentation is usually the right procedure. A lift, on the other hand, is actually almost the complete opposite. Usually with the lift, we have a patient who has loose skin or has lost breast volume from losing a lot of weight or from previous pregnancies, fluctuating the size of their breast. They have a lot of looseness to their tissue. Most of that breast tissue is kind of hanging below the fold native breast footprint. Lift procedure is used to bring that tissue back up into the breast footprint in an aesthetic way. But it really just kind of depends on what the patient is looking for. So if a patient is strictly just wants her breasts to be back where they were kind of when she was younger, and she's not necessarily looking to be larger or for a distinct cleavage line, a lift may be completely sufficient. In some cases, if there's a lot of weight loss, for instance, and there's a big change in volume also, then we may recommend using an implant. Breast augmentation with a lift is performed very commonly and is very safe. On some occasions, I will recommend staging it, meaning we would do a lift first and then come back later and put an implant in. If I feel that doing those two procedures together would increase your risks for having a complication or an undesirable outcome. People commonly ask how long are their breast implants going to last? Do they have to get them changed every 10 years? Because that is something that you'll find on the internet. The answer is no, not really. Your breast implants will likely, if you get sized appropriately, you don't have a lot of changes in weight or changes in your breasts life stages, your implants can last anywhere between 10 and 25 years. We every year are developing new breast implants, making slight changes to our older technology, and we come out with newer implants. I tell patients breast implants are kind of like Toyota Corollas. A 2022 Toyota Corolla, no one knows how long it's going to actually last, but we know it's a very reliable brand. The older cars do very, very well, and we assume they're just going to keep getting better. It is inevitable, especially if you're getting implants when you're young, that you will likely need to have them replaced at some point in your life. You may get new implants, go larger, go smaller, or you may just elect to have those implants completely removed. When it comes to asking for implant removal, not necessarily because their implants are giving them problems, just because they say that the implants have served their purpose. They're done with them and they just kind of want to be small again. In those cases, it's very dependent. Usually, if those implants have been in for a really long time, that skin has some laxity. We're usually recommending some sort of procedure to compensate so when the implant is removed that it's not left hollowed out in the breast or with a lot of loose tissue. It just depends on how large the implants were when they were originally placed into the patient. If you're looking for any more information about this procedure or any of the procedures I performed, please go to drcosta.com, fill out a free virtual consultation. We can review that and let you know what we think the best plan will be to get you towards your goals. Thank you for checking out my video. Comment, like, subscribe to our page to get more of this type of content. It tells us that you like what we're doing and that you want to learn more. If there's a video or a question that you want to know, please leave it in the comments. We will absolutely do our best to get that to you.